Good morning. This video is about post-laminectomy syndrome. Basically, a failed back surgery syndrome. That's what it is. Post-laminectomy syndrome is a condition where the back or leg pain continues or returns after spine and surgery. It happens more often than you can imagine, especially after a laminectomy is done for disc herniation or a spinal stenosis. Simply put, the surgery healed, but the pain did not fully go away. And the question is that why? Why this is happening? There are several reasons, often more than one at the same time. Now, so nerve-related causes, permanent nerve damage before surgery. If that has happened, then there's a problem. You're not going to have a resolution of your pain. If there's a scar tissue around your nerve called epidural fibrosis, because that fibrosis is not going to go away even after surgery. Nerve irritation or inflammation. Structural causes, incomplete decompression, recurrent disc herniation, spinal instability, adjacent level degeneration. Muscle and soft tissue causes, weak core muscles, altered posture or biomechanics, chronic muscle spasm. Other contributors, possibly incorrect original diagnosis, and some conditions like depression, anxiety, chronic pain, sensitization, they play big role in your recovery. Common symptoms, persistent low back pain, leg pain with sciatica that did not improve or came back, burning, tingling, numbness, pain worse with sitting, standing, and walking, limited function, and poor quality of life. How is it diagnosed? There is no single test. It's a clinical diagnosis supported by imaging. MRI with contrast will look for the scar tissue and nerve compression. CT scan will evaluate bone alignment. EMG nerve test will check for nerve damage. Pain pattern assessment, mechanical, that will tell us if it's a mechanical or nerve pain. Treatment option is only a stepwise approach. First one is conservative, physical therapy to strengthen your core muscles, anti-inflammatory medication, could be oral, topical, neuropathic pain medication like duloxetine, gabapentin, pregabalin, or Lyrica, lifestyle changes, losing weight, posture correction, very important. Interventional pain treatment, sometimes you may need epidural steroid injection, facet joint or nerve root blocks, or sometimes even radiofrequency ablation of the nerve. Advanced therapy is spinal cord stimulation is very effective for nerve pain, and sometimes even intrathecal pain pump in selected cases. Repeat surgery? Yeah, only if a clear and correctable structural problem is found. Otherwise, your surgeon is not going to touch you. Success rates are lower with each repeat surgery, right? So this is what I'm going to tell you is that important message for you. More surgery is not always the answer. Many patients improve with conservative treatment, with the pain modulation, rehab, weight loss, core strength, core muscles strengthening exercises, and nerve focused treatment. Okay, not another operation. And when should you seek help? Urgently. If your leg weakness is progressing gradually, or if you have any bladder problem or bowel problem, like all of a sudden you cannot hold urine, or you have bladder incontinence, or you have fecal incontinence, and then there's a problem. You need to seek help urgently. Or suppose all of a sudden you have a weakness of your muscles of extremities, right? So bottom line is that post-laminectomy syndrome is real, it's common, manageable, but it requires correct diagnosis, multidisciplinary approach, patience, and realistic goals. Okay? So thank you for watching. I'm Dr. PK from Dr. PK Life. Have a great Thursday.